Good day to all of you, those of you who are listening in today's Integrative Living webinar. And these webinars are my way of bringing to you a pre-recorded dialogue and discussion about different topics related to integrative living, where we work with emotional intelligence of the heart, the thought process of the mind, the living process of the body, and the journey of the soul. At Aneeta Madhok's Integrative Living, we offer a 6-month health coaching package for all those who wish to upgrade their health and lifestyle, but especially for those who are suffering from lifestyle related diseases like diabetes and obesity. Today, my topic is oral health, and that's what we are focusing on, and how important oral health is for overall health. My guest today is Dr. Deepa V, who's working as an associate professor at the Kodagu Institute of Medical Sciences in Madikeri, somewhere in the Coorg district of Karnataka. So Deepa is known to me from the past. We have had a long association with her over the last couple of years, and I know her very intimately, and she knows me very well. And I'm really delighted she's come out with this book. But just to tell you, she's the proprietor of Benika Dental Care and Shivam Diagnostic Center at Coorg in Karnataka, India. She has done the BDS from Government Dental College in Bangalore and Masters from Dayanand Sagar College of Dental Sciences, also in Bangalore. Oh, she has a lot of national and international publications to her credit. She has presented so many papers at various national and international conferences and authored many articles about oral health in Kannada newspapers, English newspapers, and she's given a lot of awareness talks about oral health and cessation of tobacco use on All India radio and TV channels. She's trained students, police officers, ASHA workers in tobacco cessation programs. And she was also very talented because she was judged first in a national level poetry competition. Not only that, she's also involved deeply in research. So she's the reviewer for the Journal of Evolution of Medical and Dental Sciences since 2017 and the Journal of Oral Medicine and Dental Research. Her areas of interest include oral cancer genetics, aesthetics in dentistry, and cone beam computed tomography and Indian classical music. Boy, that is a real great resume that Dr. Deepa has. But today we are not talking so much about her past. We are talking about the book that she's just published. And her book is very interestingly called I Lost My Tooth for Biryani. Deepa, can you show the audience your book, please? I Lost My Tooth for Biryani, which tells us not just about oral health, but much, much more than that. As we go along, we'll know more about her books and her thoughts. Indian mythology is replete with references to Agni. You know, we talk about Agni in all our mythology. It's a god of fire or the fire god, the first god that was referred to in the Vedas. And, you know, in India, whenever a Hindu will want to speak to the gods, he will light a fire, he'll light a candle, he'll light a diya, he will light a homam or light a havan. And it's through the fire that we communicate with the gods. So Agni is often referred to as the mouth of the gods or the messenger between celestial and temporal. And in our thinking also, the mouth is the entrance point with which we engage with the outside universe. It's the first level of defense against bacteria and against infections. It's the first place where we welcome in good food and nutrition into our bodies. And it's also the first place that, the outside world we encounter. In far off Indonesia, there is mythology that tells of how dragons use various forms of bad bacteria in their mouth to spew venom on others. So the venom is not so much something that they secrete or they excrete, but it gets created because of bad bacteria in the mouth, and that becomes so venomous that it can poison other people. Of course, this also mentioned in Deepa's book, but there is also a reference to the oral cavity in the story of how the whole universe was visible in Krishna's mouth as the first miracle that he performed as a child. There was a story when Lord Krishna put some mud in his mouth, and when his mother inquired about it, he opened his mouth and she didn't see the mud, but she saw the whole universe in his mouth. So actually, there is a large universe that resides in our mouth. But I want you to I want Deepa to tell us. Deepa, my first question is, what is the universe that you see in people's mouth? Hmm? And you have an entire chapter in your book called Show Me Your Mouth and I'll Tell You Who You Are. Hmm? So I'm very curious to know, because I'm a psychologist, I'm very curious to know, how can you tell who a person is by looking in their mouth, and how can you assess overall health and who the person is from his or her oral health? So Deepa, over to you.
Uh, Thank you, Dr. Anita, for that elaborate introduction. Um, I would like to tell that just like our fingerprints, our bite marks are also very unique. Uh, you asked how we can identify a person just by looking at their oral cavity. There are many, many clues that we can get to identify a person just by looking at their oral cavity. Say, we can identify the gender of an individual, the age of the individual, and the diseases they are undergoing, not many things. To give an example, the lower front teeth erupt only at the age of 6 to 7, and the upper front teeth erupts at the age of 7 to 8, and the lower canine erupts at the age of 11 to 13, and upper canine 12 to 13, and your third molar erupts at the age of 17 to 21. So you can determine the age of the individual just by looking at the teeth, the complement of teeth that is present. You can determine the gender of the individual based on the shape and size, the morphology of the teeth, the jaw size. So there are so many things that will help us determine the age of the individual, the gender of the individual, and if at all they are struggling with any disorders, even that can be known just by looking at the oral cavity. We know that by looking at the appearance of your face, we say that face is the index of a human mind. Just like that, our mouth or the oral cavity is the index of our overall health. This is what I'm trying to emphasize in my book. Say if a person's lip is chapped or he's constantly biting on his lip, then we can say he's psychologically ill. Suppose the lip is drooping on one side, then you can say he has some palsy, facial palsy. Or if there is any fissuring, painful ulcers at the corner of the lip, then you can always relate it with some iron deficiency. If they have any discoloration, then we can always relate with some habits like smoking. So you can determine the personality of an individual. If they have any tattoos or jewelry, then you can relate with the cultural taboos they are associated with. Like this, there are a number of things that we can identify just by looking at the individual's oral cavity. So it is not when we say about mouth or dental dentistry, it is not related just to one small tooth. Your overall personality is reflected just by looking at your oral cavity. So this is what I'm trying to emphasize in this book, and we'll be discussing much about it later.
Okay. We lost your voice for a few moments there, but I think overall we understood what you've said. I hope it doesn't happen again, but never mind. We do know, and I have learned this, and we have been taught right from the time we are born that we should brush and floss our teeth twice a day and wash our mouth after every meal in order to maintain good oral health. I also read your book, which is written so beautifully and so succinctly, explains it such a simplified, beautiful, and understandable way, the importance of taking care of our teeth and oral health. So, in brief, what do you say about good daily practices for oral health?
I would say that we should always brush twice a day, once in the morning and once in the night. It is a good practice that we should brush our teeth after having our dinner. And then in the morning, it is according to the literature, it says we can brush our teeth after having our breakfast, but mostly we are not so comfortable having our breakfast even before brushing. So it is left to our discretion. If you are comfortable, then it is said that you should brush once in the night after you have your food. And since your mouth is clean, you don't have any food debris left and the bacteria is not acting upon. So in the morning you can even brush after you having your breakfast. And then you should always floss, because when you brush you're covering only 70% of your occlusal surface, but to cover interdentally that 30% you have to floss. You have to use interdental toothbrushes, or you have to do flossing. There are different type of flosses available in the market. It can be the super thin floss, which will help us in cleaning interdentally in between two teeth. That helps us in cleaning. So flossing needs to be done other than brushing. And other than that, you have to also use mouthwashes. And it is said that you have to use fluoridated toothpaste so that it demineralizes your teeth structure and keeps it healthy. So the amount of toothpaste what we have to take is, in a kid it is a pea size, and in adults it is about 1 centimeter. Of course, in a very small infant, you can just take a streak of toothpaste, and the toothbrush what we are using should not be used for a long period of time. It has to be used only for 2 to 3 months, and you discard it whenever there is any infections. Say if you have any fever or anything, then it is wise to discard the toothbrush. Otherwise, you are getting re-exposed to the infection. And also, once you feel that the bristles are getting frayed, it is better to dispose. Otherwise, you are unnecessarily creating pressure on your teeth, and that will cause erosion of your teeth. One layer of your teeth gets eroded, because of which you will be facing sensitivity to hot or cold food and other problems. So it is better to keep changing your toothbrush regularly. But you should not be changing your toothpaste frequently, because there's a content called sodium lauryl sulfate, which can cause hypersensitivity in some individuals. So it is better to use the same kind of toothpaste when once you are feeling comfortable, not frequently change your toothpaste. And yes, you have to use mouthwashes so that it cleans the interdental area, and also it will clean the other surfaces which we are not able to physically clean with our toothbrush. And in people who have less muscle dexterity, we can also use powered electric toothbrushes, which will help in maintaining good oral hygiene. So these are all some of the tips that we'll have to follow to maintain good oral health.
Wow, that's totally, in brief, everything that we all need to do and be conscious of and aware of on a daily basis. But I was not aware of having to, change your toothbrush every couple of months. Now I think I will keep track of how old my toothbrush is and change it. But there is always a hard and medium and soft toothbrush. So, which is the one that we should choose, and on what basis should we choose which is the toothbrush to be used by us? Sorry, this question is out of the blue, I know, but
Uh,
which is the right toothbrush for
this
us?
is something which is really important. We have to always use a soft bristle toothbrush, because we don't have to exert too much of pressure when we are brushing. So gentle force, gentle pressure by using soft bristle toothbrush is enough to clean the plaque or the tartar, whatever is getting accumulated, when you are brushing twice a day and getting professional round of cleaning once in every 6 months. So I would say that you always go for a soft bristle toothbrush. And the other thing is, we'll have to always maintain strokes like upward down. It has to be vertical motion and not horizontal. You should not be applying lots of pressure and brushing very horizontally, which will exert lots of pressure on the teeth, which will wear away the tooth structure easily. Either use upwards down stroke, or use circular motion. That would be the better choice.
Today, the market is full of so many different kinds of toothpastes and so many different kind of toothbrushes. And what I'm learning from you now is that not to go for hard toothbrush or something which has very sharp bristles. Go for a soft one, and not to brush for too long, but to brush for just a couple of minutes, and to use consistently the same toothpaste that works for you, and to try which is the one that works for you and use it consistently. So that's very good insight for me. So, okay. So, there are many, old traditions that we are discovering today, that foster and enable oral health. Traditionally, there used to be a practice of oil pulling. Some people do gum massage with their fingers. Some people do a jal niti. Some insist that tongue cleaning is also an essential part of oral hygiene. What is your take on these traditional practices? They also use a datun, kind of a neem stick, which is for cleaning sometimes. And a lot of people are leaving the toothpastes and going back to, using the neem sticks for cleaning, because they believe that there's too many chemicals in toothpastes, and they don't believe in putting the chemicals in their mouth first thing in the morning. A lot of people are doing oil pulling. I know many health coaches and health conscious people who put the coconut oil in their mouth and leave it there for 15 minutes in the morning, and gets rid of a lot of toxins in the body. What is your take on these practices, the traditional practices, as compared to modern day science?
Yeah, the use of oil pulling is mentioned in Ayurvedic scriptures from quite some time, and yeah, oil pulling actually will help in reducing the amount of germs in your mouth. It is antibacterial, but um, there are literatures which say that you can keep the oil in your mouth for about 15 minutes and spit it, or you can just swish and spit for 2 to 3 minutes. You can use different kinds of oil. It could be virgin coconut oil. We have literatures which say that virgin coconut oil helps in the treatment of after ulcers, because it coats on the ulcers and it will prevent that stinging sensation. You feel uncomfortable whenever you have those ulcers. So uh, that's that burning sensation is reduced partly. And also, whenever there is mucosal tear because of the constant use of tobacco, it will result in lesions, something called leukoplakia. We have literature which says that use of virgin coconut oil has helped in treating this leukoplakia. In the pre-malignant state, yes, it has helped out. And people do use castor oil, sesame oil, and they use some flavors to that by adding some basil leaves or cinnamon, and do oil pulling. Uh, of course, it's not causing any harm, but you can use it.
Yeah. So recently I saw a very large FMCG company that's coming out with different flavors of oil for oil pulling. It's normally it sells only toothpaste, this particular company, but now they've also come out with a new product of oil for oil pulling, and trying to commercialize the market over there. So obviously there is a lot of people out there who are doing the oil pulling, and otherwise
There
big
is
companies. Yes.
there's no deleterious effect by doing oil pulling. I think it is safe enough to do it. We can practice. And you also asked about uh, the use of neem barks. But neem barks, again, it is antibacterial. We can use it, but it is not going to reach till the distal end. So I really don't say that it should be the only method of your oral cleansing. If at all you're supplementing with your normal toothbrush, then that is okay, because it is just a part of cleaning your oral cavity because it is aggressive. But then, because our distal end of the tooth is not really touched upon, I do advise that either only oil pulling or using neem barks would serve the purpose.
Okay.
It can be used along with your normal toothbrushing and flossing.
So the neem
And
bark.
gum massages, again, you can do gum massages because it will help in vasodilatation. It will increase the circulation to your gums, and that in turn improves the nutritious supply to your gums and keeps it healthy.
So what is your take on the tongue cleaners that traditionally people
Tongue
would use?
cleaners, yes, we have to clean our tongue. Otherwise, there'll be whitish coating on your tongue, and there'll be bacteria accumulating on it, resulting in halitosis, bad breath. So, yes, we have to clean our tongue.
Okay.
Dr. Anita, I know that you are an integrative nutrition health coach, and you look upon the whole person's health. You
Yes.
have access to some very new and recent discoveries that are not a part of medical sciences. I do know that there is much talk about the gut microbiome, and now many are speaking about the microbiome and the oral microbiome. What is your advice to the people who want to live a mindful and conscious life?
If you look at traditional Indian Ayurvedic and other forms of Indian medicine, which are the traditional ones, they always say that all diseases, all illnesses, they come from the gut and from the mouth first. And today, there's a lot of research, modern day research, which has not yet entered the mainstream, but it's in the functional medicine domains, that shows that the microbiome is a vital part of our living process in a multitude of ways. So we have something called the microbiota, which consists of over 3 trillion cells in our body, weighing over 3 kilograms. So if you think your body weight is, 60 kilograms, you can minus 3 kilos of that weight that does not belong to you, because these are actually small microorganisms or microbes or bacteria, funguses, yeasts. They live in symbiosis with our body. In fact, now the research is showing that our bodies are a vehicle for these microbes to hitch a ride with us. I have also learned that most of the microbiome resides in the gut and particularly in the large intestine. And it is closely linked to our brains through a complex series of nerves. So the maximum number of nerve endings is in our large intestine and in our gut, and the gut microbial activity can and does impact both our physical health and our happiness in all ways possible. So mostly there are good gut bacteria and there are bad gut bacteria, bacteria and yeasts and all kinds of microbes. So the activity of the good and bad bacteria are intricately linked to your positive and negative emotions and thoughts. So if you think you are who you think you are, then think again, because mostly you are what your gut bacteria are. So it's very important to feed the gut bacteria with the right kind of probiotics and prebiotics so that the good bacteria survive and the bad bacteria don't take over. All illnesses come because the bad bacteria in our gut has overtaken the good bacteria. So, but that's not so much about the gut microbiome. I want to talk to you because you're a dentist and dental specialist. I want to talk to you more about the oral microbiome, or the microbes that live in our mouth as the gateway to and the first point of entry of all things good and bad into your bodies. And so we eat from our mouth, and every time we eat, a lot of the activity of the microbes, it interacts with the food along with our saliva and other secretions, and that's what we swallow. Now, if we don't have good bacteria in our mouth and we have only bad bacteria in your mouth, you've got a coated tongue, or, you've got bad breath and things, then that bad bacteria also goes into our system. And the first step of digestion in our body goes out of sync and out of, So if you have good oral microbiome, it's a good thing, because when you eat your food, you chew your food, the microbes in your mouth, they kind of begin the digestion process and then allow the food to go in, and it goes in right. So a oral microbiome resides all over the mouth, but we learn that 90% of it is not in the teeth, but on the tongue. 90% of the oral microbiome is on the tongue, and most of it is on the back of the tongue. So it's very important health habit to keep your tongue clean and healthy. And we always recommend the use of a tongue cleaner, preferably made out of copper, so that there is no coating on your tongue which is unhealthy. And your tongue should look clean and pink and and completely healthy. That's the first step. Um, Sorry about this, Deepa, but today research is showing that if you use mouthwash, particularly mouthwashes, strong ones, the ones that are antiseptic like Listerine, not the mint paste mouthwash, but the antiseptic mouthwash, it kills the good bacteria in your mouth. And very clear research has been used, has been shown that people who use Listerine kind of antiseptic mouthwashes, they are susceptible to high blood pressure, because there is a link between the oral microbiome and your blood pressure and hypertension. So it's very important not to use not to use mouthwashes, because that's when your tongue gets completely antiseptic, and even the good bacteria get killed along with the bad bacteria. So to keep your tongue clean, only a tongue cleaner is advisable, and definitely not a mouthwash. And the other thing that kills the oral microbiome is fluoride. And there is a lot of controversy. Some pro fluoride and some anti fluoride kind of lobbies exist, but we do know that fluoridated toothpastes kill the oral microbiome, and the good bacteria go out with the bad bacteria. So this is what, as an integrative nutrition health coach, our advice is to people to use tongue cleaner regularly and to stop using any kind of mouthwash or even any kind of fluoridated toothpaste. So that's my take. But this interview is also about you. I'm very intrigued by the title of your book. I lost my tooth for biryani. Now, we all love biryani. You love biryani. I love biryani. But I don't love it so much. I don't love biryani so much that I would lose my teeth for a biryani. But it's a very intriguing topic. Why and how did you think of this topic? Whom is this book for? What is your core message? Just tell us something more about your book.
We all know food has an impact. Ma'am, shall I walk you for
No.
Dr. Anita, thank you so much for your insights. That's much valuable because we all know our oral cavity has a beautiful ecosystem and oral microbiome plays a very, very vital role. We have both pathological bacteria in our oral cavity and the bacteria which will help in maintaining the ecosystem of our oral cavity. Say the bacteria like Streptococcus mutans, which are normal commensals in our oral cavity, becomes pathogenic when it is in acidic medium. So the food what we consume plays a very, very vital role. That is how I am relating my book title also. That food plays a very vital role in our overall health. So when we consider mouthwashes, yes, it is deleterious to use mouthwashes for a long period of time because it is antibacterial and bactericidal also. Some mouthwashes are prescribed only because of the medicative effect they have. Say in certain conditions when the person has severe gingivitis, severe inflammation of the gums or the periodontium, in those cases we advise mouthwashes, or in severely debilitated people where the mouth where they can't really take good care of their oral cavity. In those cases, as supplement, we advise mouthwashes, but it is wise to use for a week, not more than that, because it will stain. Also, chlorhexidine is supposed to be staining your teeth, so we don't say them to use constantly throughout. Use it for a short period of time, as advised by the doctor, as advised by your dentist. We don't advise mouthwashes throughout. So this is one thing we'll have to keep in mind. When you're using mouthwashes, it should be for the prescribed period of time, whatever your dentist has advised.
So tell us more about whom your book is for and what is your core message that you would like to give through your book
Yes,
to the rest of the world.
yes. I chose this topic. I lost my tooth for biryani because biryani is a culinary which can be related from the time of Mughals. And if you trace the origin, you can even notice that it was there from the time of Nala and Damayanti. So this is one culinary that can be fondly cherished and relished by most of us. Say if I take some food which is not closely related to us, you can't relate with the book. So I particularly chose this topic so that we all can relate to it and enjoy. And yes, this book is written to bring awareness among the general public, because when I write articles, it used to reach only a small group of people. But then I got suggestions to write a book, and this book is for the wider mass. It should reach the general public, and they should understand that by improving the oral health, we can improve our overall health. And of course, my other colleagues and dentists can read this book so that they can relate with many anecdotes what I have mentioned in my book. And for the dental students, where I've written lot many things in the form of story. Whenever anything is given in the form of story, that becomes interesting. So you can grasp the concepts easily when you are reading in the form of story. So my book is for everyone, everyone who is health conscious.
Wow, I love core message, oral health is overall health. And I remember when you spoke about the book, even before it was published, when you mentioned it to me when I met you last, I was very impressed with that, that correlation. And I couldn't agree with you more, because it all begins in the oral microbiome. I couldn't agree with you more. But tell me a little bit more. You have a whole chapter which you have titled Oral Health of Lakme, and you have given special importance to oral health for women as compared to men and differentiated between the two. Could you elaborate a little bit on that, please?
Yeah. Oral health keeps changing in females right from the childhood, adolescence, during the time of puberty, and during the time of menopause. In kids, definitely because of the stress when they are attending their exams, or because of the lack of oral health measures, there will be increase in oral ulcers. We call this as actus ulcers, or there can be increased incidence of dental caries. During the time of puberty, we have this puberty gingivitis where there is inflammation of the gums. Your gums get swollen, becomes red. Generally, the gums are pale pink in color, but when there is inflammation of the gums, then it becomes swollen, reddish, and it bleeds easily. When you're brushing, it bleeds easily. And during the time of pregnancy, again, we have this condition called pregnancy gingivitis because of the change in hormones. There's increase in the hormonal levels, especially the progesterone in estrogen level, because of which your gums tend to become fragile, soft, and it starts swelling up. And there will be growth interdentally between your front teeth, and that growth, when you brush, it will result in painful. It results in pain, and the tooth also becomes loose. It is for a tentative period of time. It's not
I was
permanent.
asking why women as differentiated from men. Wouldn't the same principles apply to men and women?
It is because of the hormones, especially in females. The
Okay.
hormonal changes what we undergo is slightly different from that of males. So special emphasis is given in females. And during menopause, again, we get to see lots of changes in females, especially like burning mouth syndrome, where there's burning sensation in the oral cavity. They have iron deficiency because of osteoporosis. Again, our bone tends to become weak, and um, teeth tends to become loose. So females will have to take extra precaution and care so that they can maintain good oral health throughout their lifetime.
Okay. It's special for women. They need to take extra special care. And do you find that when it comes to the older population, the women are more your clients than men?
Yes, yes,
Yeah.
that is
So
it.
one of the things I must appreciate about your book, there's so many beautiful quotations you have selected from everywhere. And one of the quotations is from Charlie Chaplin. You'll find that life is still worthwhile if you just smile. So I just want you to lift the veil of the Pandora's box through the mouth.
Yeah. So I want to say that just by looking at the oral cavity, you can get to diagnose lots of other conditions. Say a person is diabetic, then by looking at his oral cavity, I can get to say that he is diabetic, because there are some changes that we can get to appreciate in the oral cavity. Around your teeth, the gums become loose, and there will be abscess, periodontal abscess. This is what we call. Because of this abscess, there is increase in inflammation, which is in turn resulting in uncontrolled diabetes. So both are interrelated. Once you control the diabetes, your periodontal status improves. If the periodontal status is bad, that will result in diabetes, uncontrolled diabetes. So everything is interrelated in our body. Suppose there is bacteria in your gums. These bacteria get into the blood supply, and it will reach your cardiovascular system. It will reach the valves, and it will impede in the blood circulation. It forms an atherosclerotic plaque. It will form a plaque in the blood vessels that will impede in the blood circulation, as a result of which there is increase in the blood pressure, there will be increase in the heart attacks, strokes. And the bacteria present in your oral cavity also can get into your lungs and cause pneumonia.
Yeah.
And in pregnant females, just because of these bacteria, that will result in stress inducing hormone, oxytocin is increased, and because of which there are incidents where there is um, stillbirth babies or low birth weight babies. These are all some of the incidents what we can get to see just because of the bad oral hygiene. So I want to make everyone clear that our oral health has a very intricate mechanism. It is so closely related with our overall health. So your Pandora box is opened just by looking at the oral cavity. That means to say lots of conditions which are left undiagnosed can be identified just by looking at the oral cavity.
Wow.
So
And I think this is just the tip of the iceberg. You got to read the book to get to know the bigger picture,
yes,
the whole and the total picture. So that's good. I folks, all those of you who are listening in, please make sure you get that book and keep one copy in the house, because every member of the household would be able to benefit from reading even parts of that book. It's totally amazing, very well written, lots of stories, lots of narratives, and lots of very interesting tidbits like this. So, any one line message to you, to the audience, Deepa, if from your side?
now we have understood that by improving our oral health, we can improve our overall health. So, by improving our oral health, let us maintain this confident, beautiful smile throughout our lifetime. So, all of you keep smiling. Cheers.
Thank you. Keep smiling, everybody. That's a wonderful message. And, on behalf of Aneeta Madhok's Integrative Living program, I want to really say thank you. So, folks, this is what integrative living is about. It's not just about the food we eat, it's much more than that. And for those of you who are looking for a total life and health transformation, and not only health, but also happiness transformation, it all begins with looking at your body and your mind and your heart and your soul. So do come in and inquire more about our 6-month health coaching program, so that you can begin your journey of self healing and move closer towards good health and happiness for the rest of your life. Thank you very much for listening in, and goodbye. Thank you, Dr. Deepa.
Thank you, Dr. Anita.